My name's Dr. Michael Criqui. I'm from the University of California, San Diego School of Medicine. And my presentation today was about the relationship of the density of calcified coronary plaque and its relation to future cardiovascular events, both heart attack and stroke. We've known for some time that by using computed tomography X-ray scans of the chest, you can determine whether or not a person has coronary calcium. It's quite common such that by age 50 or 55, about half of all Americans have some coronary calcium. And we've also known that the more coronary calcium you have, as determined on your chest X-ray, the particular CT, computed tomography X-ray of your chest, the higher your risk of having a future cardiovascular event is. The reason that it is such a good predictor is because the calcium actually is directly on the X-ray, and all the X-ray can see is the calcium. It can't see the whole plaque, but we know that the amount of plaque is directly proportional to the amount of calcium, and so that's why it's a good predictor. But calcium, the density of these plaques varies. Some have a little bit of calcium, you can barely see them, and some are very, very dense. They're just almost essentially like bone. And what we found is that at any given level of plaque volume, that the denser the plaque is, the safer it is. So it's still not good to have plaques, but if you do have a plaque, we found in this new research that the denser the calcium is, the less likely you are at any given level of volume of plaque to have a heart attack or a stroke. And the reason is we think that a very dense calcified plaque indicates the plaque is mature, it's stabilized. It's the plaques that are somewhat younger and have not fully calcified, than only partially calcified, that are actually more unstable and more likely to have a thrombus occur in them, a blood clot, and actually produce a heart attack